Thank y'all for joining my discussion about medical marijuana. First question: who believes medical marijuana should be legal across the United States? Why do you think that?
I believe that it should be legal because it can stop and help cancer patients, among other things, and it can reduce the spread and the growth of cancer cells. And it's a very accessible and it's a very easy to get treatment option for many people.
Okay.
Back to what you and he said about the cancer treatments, I have a family member that really uses it to help her with her cancer treatments, and it's the only thing that will help her.
Okay. You believe it should be legal?
Yeah.
Why do you think that?
Cause it may, like, if you have a card, it'd be easier for younger kids and stuff like that to get a hold of it and try it and stuff like that, and probably impair driving and stuff, make you worse at driving.
You believed it wasn't? It should be legal?
No, I don't think it should be legal unless it is totally administered by a doctor. But to have a card like he was saying, no, because I think we could head down the same road as an opioid issue. Someone taking it from somebody, okay, if it was prescribed, let's say to Jacob down there, and then I sneak in and get his medicine. So it's gonna be hard to control, I think, and monitor that way.
Okay. How do y'all believe we should properly educate people on the risks and benefits of medical marijuana?
I think it should be like any other medical procedure. You should have a doctor go through informed consent, so they should explain to you possible side effects, like with any other medication. And I think that possibly you could teach about it in school as well, and just generally stop demonizing it and more educating.
Okay. Anybody else?
Yeah, again, I think on the education, you can educate, but how much is going in here to think of what the negative outcome may be? Which, yes, there is positive. That's why I said maybe if it was administered by a doctor, or you went to a treatment center like that, would be okay, so that it's controlled better.
Okay. What do y'all think will stop a doctor from taking the biggest amount of money and just saying it's legal and it'll help with all your symptoms and things?
Losing their license.
Okay.
That's the one thing that would stop it. If it's a younger doctor that's worried about getting their license revoked, yes. An older doctor, no.
Okay. You? How do you feel?
I feel like what Brandon was saying about it, like teaching it instead of demonizing it. Like, if a doctor were to prescribe it, maybe it'd help it a little bit. But since everybody's talking about, oh, how it's bad for you, it's a drug, I just think people need to be educated and actually know the truth about it.
Okay. Thank you. Thank you all for coming to my discussion and speaking about it. Y'all have a good day.